5 everyday foods you need to avoid to stop tinnitus. Tinnitus, or persistent head noise, is a complicated disorder with numerous causes and symptoms. While no foods cause tinnitus, there may be a few that make it louder or practically agonizing for many sufferers. In this video, we will show you 5 daily foods you need to avoid if you want to stop your tinnitus. And before we start, please like the video and subscribe to our channel. In the description, you can also find a supplement to help your hearing health and instructions on how to treat tinnitus naturally at home. 1. Sugars. Diabetic patients are more prone to have an increase in tinnitus when they consume sweet foods such as chocolate or candy. The eyes, ears, and brain all need oxygen and glucose, sugar, from a person's blood supply, and when glucose levels rise, hearing might suffer. 2. Salt. Sodium has been shown to worsen tinnitus for a simple reason: too much salt raises blood pressure. Blood has a harder time circulating freely as blood vessels contract, and blood and heartbeat can actually be heard in the ears as tinnitus becomes louder. Many people who lower their sodium intake by avoiding salty snacks and processed foods experience less tinnitus. 3. Coffee. Many tinnitus patients have quit drinking coffee on the advice of their doctors. Tinnitus is known to be aggravated by stress, and increasing caffeine use might trigger stress responses. However, new research suggests that limiting coffee intake may not alleviate tinnitus, and that caffeine withdrawal may worsen the condition. 4. Saturated fats. Cheese, butter, red meat, and other saturated fats raise cholesterol levels, which can lead to atherosclerosis over time. Tinnitus is known to be worsened by atherosclerosis, which also increases a patient's risk of heart disease and stroke. 5. Alcohol. Some tinnitus patients say that they are unable to drink as much, or at all, because of the influence alcohol has on their tinnitus. Alcoholic beverages contain sugar, promote dehydration, and raise blood pressure, all of which can amplify tinnitus. What is the science saying? Medical experts dispute on whether food affects tinnitus. Because there is currently insufficient study on the subject, it is up to each patient to decide whether a dietary adjustment could improve symptoms. The main thing to know is that everyone's body reacts differently to chemicals. Whether you discover that a certain meal or drink is affecting your tinnitus, visit your doctor to check if there is a relation. If your tinnitus becomes more evident the following time you consume the food, you can either avoid it entirely or enjoy it occasionally. A hearing specialist should review your problem in addition to consulting your doctor about your diet. If you have any comments, please share them with us.